The second wave of the COVID-19 pandemic has created a medical oxygen crisis, leaving many patients struggling to breathe. President Buhari has now approved about 6.45 billion naira to set up 38 oxygen plants to help treat patients as oxygen usage surges. According to the Nigeria Center for Disease Control, only 1,270,520 samples have been tested since Nigeria recorded its first case of the virus in February last year. But experts say that the country needs to ramp up testing to slow down the rate of infections. Joining me via Skype is physician and cardiologist, Chairman, National Polio Plus Committee of Rotary International, Dr. Tunji Funsho. Good morning, Doctor. Thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
All right, let's begin with the peculiar challenges that the second wave has brought. And one of it is the oxygen, that's the medical oxygen crisis, I beg your pardon, which has caused a lot of challenge across the hospitals in the country and is raising concerns for a lot of persons. I wonder how concerning this is for you, in spite of the developments that the president is coming up with, releasing funds to address this. How far would that go as well? Hello?
I missed the last bit, I missed the last bit.
Now, I was asking that how concerning is this development, this oxygen crisis that we are facing in this pandemic, where you see some Lagos State saying that it has recorded, it's, empties about over 60 cans of oxygen in a day, in 24 hours. I wonder how concerning this is for you. Then you can also touch on the president releasing funds to also address this. How far would that go?
Well, it's a very sad situation that we've not planned to see this coming. I think it's obvious to anyone in the medical field that emergency care, oxygen is fundamental. It doesn't really have to be COVID. And a lot of conditions, particularly when it partakes to the lungs, any kind of severe pneumonia, any kinds of severe heart disease, you will need oxygen. So the issue of oxygen now cropping up, as a challenge is a little bit worrying. And I believe, we're going to be in this pandemic for quite a while. And it is time that the government ramps up its preparedness to ensure that those who are critically ill and require oxygen get it as at when due. It is really getting beyond the reach of the average person.
So are you saying that this crisis that we are facing in terms of the shortage of oxygen is a reflection of a level of preparedness that we weren't properly prepared towards addressing this pandemic?
That's precisely the case.
All right. And now the president has gone ahead to release about 6.45 billion naira to set up 38 oxygen plants. How far is that going to go to addressing this issue, seeing that you said that it's obvious that this pandemic will be with us for a long time?
Yes, as I was, trying to say, in the short term, it's not going to be of much use of those people who are right now struggling for breath because they need oxygen. But in the long term, to ensure that our emergency care is properly taken care of. Currently, it's such an embarrassing situation to find ourselves in terms of dealing with emergency care. Oxygen is very fundamental. I think in the meantime, our most urgent task is prevention. And I think we need to spend a little bit more time trying to communicate with the public, because disease is about first and foremost prevention. If you take the common example of malaria, our first line of prevention for malaria is to, as much as possible, make sure there are no malaria in our environment. That's why we encourage people to clear any stagnant water around them to prevent mosquitoes from breeding. They are the vectors. The next step is to make sure that people who are vulnerable sleep under insecticide-treated nets. The next step now comes when, despite all of these steps, the person comes down with malaria. Then we give malaria treatment. In the case of malaria, we don't yet have a vaccine, but at least we know we can treat. If we give adequate treatment early enough, then people will not succumb to malaria in terms of death or mortality. It's the same thing for COVID. I think we're placing a lot of emphasis on treatment. We're not doing enough in prevention. And the prevention for COVID-19, before we get to the issue of vaccines, is actually putting a barrier between yourself and the virus. The best way to do that is to wear a mask when you're outside your bubble. In other words, outside your house or your office environment where you have control. In other words, everybody around you should wear a mask. Everybody around you should sanitize regularly, washing their hands or using hand sanitizers. Those are the main paramount things you need to do. And of course, avoid gatherings, particularly indoor gatherings, as much as possible. Only essential things, and even then, the numbers should be limited. And that is where our emphasis should be right now.
All right, but in laying emphasis, would like for you to shed more light when you talk about the government laying more emphasis on that, because we see the government make regular briefings almost on a daily basis. And it keeps saying that people have refused to take responsibility because there is a limit to how far the government can go. I wonder what more with regards to communication that you want the government to address, and perhaps that would change the narrative and ensure that people embrace these preventive measures.
You see, the government has the tools. Communicating to people in our environment, up and down this country, from the north to the south, we have communication channels. Let's remove the media from this, for now. I'll talk about that later. But when the government wants things done politically, they know how to reach, from the emir, from the Bale, from the Eze, down to the local ward community mobilizers. These are very veritable tools to get this information across. The television is good, but we know how low the coverage is vis-a-vis the general population. And even those who have, sometimes there's no power for them to be able, to have access to this information. But if we can use our traditional leadership, our religious leadership that people know and trust, right from the very topmost level, at the federal level, state level, local government, ward level. These people are there. The community know them. The community trusts them. And if we put our information down that chain of structure that is already existing, that is accessible, we can change mindsets. There are still people who don't believe that COVID exists until they are personally touched. If they find somebody they can trust in their communities who will identify with this need for people to take these basic steps to protect themselves and protect their communities, because it's a two-way thing. If I wear a mask and you wear a mask, if I'm asymptomatic or I'm just incubating the disease, I'm very much less likely to infect you. And the same thing the other way around. If you are infected or you're in the incubation phase, of the disease, the chances of you infecting me is little. And furthermore, the chances of you or I populating the air around us with the virus is drastically minimized just by wearing masks. And so if we can get this information down, that will be helpful. Of course, the media has their role to play. And then we have opinion leaders. We have celebrities. You know, some of them have recently come down with COVID and survived. These are the people that we can recruit, pardon that word, recruit, you know, into this movement to ensure that that we can do, that we can afford right now, it is here with us right now, we utilize it whilst we wait for the next step in prevention, which is vaccination or immunization.
Right. Now, one other concern is the issue of testing. And according to reports, since the COVID-19 was, reported in Nigeria last year, February, and up till now, it's a little over 1 million out of 200 million persons that have been tested in the country. And that is generating concerns. And so some stakeholders, talking about private hospitals and private organizations, are saying that perhaps the government should look into partnerships with them to ensure that they push further and ramp up testing across the country.
I believe that there's already an existing partnership with the private sector in Nigeria. I think it's called COVAX or COVAC, and they have put in, tons of resources, both human and material. Some have actually provided mobile, testing stations in some states in the country. But you see, I think in Nigeria we have gone past relying on testing. Because testing involves a lot of logistics. It's not just to test. When you test, you find a positive case, you must track their contacts. You must test their contacts. And if you find those contacts that you have tested, you find anybody positive, you have to also track those who have been around them. It's a huge logistics issue. If we had done it rapidly at the beginning, it will have helped us to curb this current community spread. But we have not done so. And we have limited resources. So I believe we should concentrate our efforts in getting people to do these basic things I enumerated earlier on. Put a barrier between yourself and the virus. If you have to go out, wear a mask. Don't congregate in large groups. If you have to congregate in little groups, even, make it outdoors. Don't congregate in large groups indoors, particularly for a protracted period of time. If it's for short periods of time, make sure that enclosed space is properly ventilated. These are easy, they are cheap, they are not rocket science, and everybody can do it. Until such a time, that we get to the point where we can now start talking about all these other measures.
All right. Speaking about vaccination, the federal government says it is expecting about 10 million doses of vaccines, which will arrive in early weeks of February. But then again, we see the Lagos state government talking about rolling out vaccines alongside the federal government, and is looking at vaccinating about 50 to 60% of the population in the state, and is looking at herd immunity. How do you see that addressing the issues, the spread of the virus within the state?
Well, it's a very good start. I'm yet to see any evidence of any logistics being put in place for those vaccines. It's a humongous undertaking, vaccinating a large number of people within a short period of time. The only way we have succeeded with the polio vaccine is because you don't need trained personnel to vaccinate, because they are drops. So you can train young people in the art virtually in less than 5 minutes, because it's just, knowing how to use the dropper and knowing how many drops to get into the child's mouth. In the case of COVID-19 vaccine, they are injectable vaccines. So you need trained, qualified staff to give this vaccination. How many qualified staff who can give injections do we have in Lagos State? How are they going to be deployed? Where are they going to be deployed from? Because currently they are all engaged in their primary assignment.